In this video, Denise and I are going to show you the nursing care of a patient with a tracheostomy and or laryngectomy. In the first part, Denise is going to show you how to change the inner tube.
Okay, so the equipment we'll need for the inner tube change will be your sterile dressing pack, which will have your sterile gloves and swabs inside. We will need saline to clean the inner tube. If you work in the community though, cooled boiled water would be appropriate to use. You'll notice here I have these giant cotton buds. They look like cotton buds. They're actually trachea swabs and they're very soft. Okay, so they won't cause any scratches on the surface of the tracheostomy inner tube. Okay, so obviously I'm going to explain to my patient what I'm going to do, because it can be quite frightening, someone touching that tracheostomy tube. They're very sensitive for them. Okay, so I'm going to remove my patient's oxygen. And now I'm going to take that inner tube out. I'm just going to support the tracheostomy tube here so it's not pulling on the patient. And you'll notice just being very careful with that ring pull. Just going to pop that down onto a sterile field. Now inside this tub, I'll put my clean inner tube in. Okay, just watch it goes in the right way round. And you should hear a click. And that's us back on. Okay, so I'm going to pop this oxygen back on so the patient remains nice and oxygenated while I clean that inner tube. So at this point I'll stop and change my gloves. Okay, so we'll assume that I've changed my gloves now. And the inner tube I'm just going to wipe and use my trachea swab. Okay, so any secretions on the tube, just one wipe and dispose. And getting any remnants of secretions off the inner tube. Okay, I'm just going to wet this one and go inside the inner tube. Okay, and just make sure I am getting any dried secretions that might be in there, make sure it's nice and clean. Okay, so I'm just going to rinse. Just get the excess saline off and then dry with your swab there. And to dry the inside of the tube, just use my trachea swab there. Just make sure we get that dry. And then replace into our pot here. For the next time we need to change the inner tube. So every 4 hours this should be done. Obviously if the secretions are very sticky, then we may have to do this more than 4 hours, maybe every 2 hours, just to make sure that inner tube's nice and clear and the patient is well ventilated. You'll notice on the tub I have my patient's name. You could use your little addressograph and the size of the inner tube that should be there.
So in this part of the video I'm going to show you how to change the patient's tracheostomy dressing and their ties and clean around the stoma site. So for this we need another sterile pack, some saline in the dish there, and we need some swabs, and we need a new dressing and some new ties. So for this procedure, we're going to take off the patient's oxygen again. And then take off the patient's ties. So for this part, for any sort of procedure, removing the ties or the dressing, it's a two-person job. There must be somebody that is actually doing the changing and somebody that's actually holding the tracheostomy tube once the ties are off. So Denise, if I can get you to come a bit closer and hold on to the tracheostomy. Okay, so I'm just going to remove the ties now. Okay, I'm just going to discard that in the bin. Just while you're holding the wings there, I'm going to remove the tracheostomy dressing and discard it. Okay, so next thing, I'm going to get one of my swabs. I've got some sterile gloves on here. I've just changed my gloves. I'm going to soak this in some saline. And I'm going to go under the first wing there and clean away from the stoma, removing any secretions that are present. Dispose of this. Do the same again for the other side. Again, away from the stoma. I'm going to do the same procedure for the top of the stoma and the same for the bottom of the stoma. Once I've done that, I'm going to take a dry dressing and I'm going to repeat the procedure just to make sure that there's no wetness around the stoma site. So once that's done, you take your new stoma dressing and place it under the tracheostomy wings. So while Denise is still holding the dressing, while Denise is still holding the tracheostomy, I'm going to place the dressing and get it into place. So with that in situ, I can now take the new tracheostomy ties and I'm going to fit this round to secure the tracheostomy. Okay, just come round to this side. In terms of how tight you put the ties on the patient, you want to make sure that it's secure enough to prevent any accidental dislodgement of the tracheostomy, while at the same time it's important to consider patient comfort and to ensure that the ties aren't digging into the patient's skin. Regarding how often you do this entire procedure where you change the dressing and the tracheostomy, very much depends on the patient themselves, whether they have a lot of secretions around the site, around the tracheostomy site. That would mean obviously you need to change the dressing more often. If the patient's skin is quite excoriated as a result of moisture, you'd obviously have to be very careful not to let that get worse. So the recommendation is that you use a Cavalon lollipop stick and just dab around the site, around the area of the tracheostomy itself. Very important not to use Cavalon spray, however, as that can be inhaled into the tracheostomy.